Hi, my name's Samantha Pritchard. I'm going to be doing a video today on my practical OSCAs for INC1. My assessment is due today, Friday the 23rd at between 11 and 11:30. So I've been given this case scenario of uploading a video as a response for a case scenario. So my scenario is there's what I'll be doing is, I'll be talking about the case scenario. I'll also be talking about what I see in the video, what possible hazards or risks or immobility there could be, some factors in there, and I would just be discussing how I could help this patient and things I would do. And then afterwards, I'll be doing a reevaluation on the scenario that I will be discussing. So first, my name is Samantha and my badge is here. My last name's Pritchard. My ID number is 3150640. I've misplaced my student card at the moment, but yeah, that is my ID number. So I did watch a case scenario. So I was given the scenario that I had Mallory. So Mallory is an 84-year-old elderly lady. She had a fall at home. We're just doing some investigation at the hospital as she's been admitted, and the RN has now given me the okay to oversee her for the next 15 to 20 minutes as this RN is off to see another patient. So the RN has given me orders to just see how this patient is doing and just watch her for a little bit in the meantime. So this patient, Mallory, has said I could do whatever, just do a little check over of her. So what I would do first was I will address myself to Mallory. And yeah, so I will start now. So I'll go to Mallory and I'll say to her, "Hi, my name is Samantha. I'm a student nurse and I will be assisting you today. How can I help you?" And I'm guessing she'll let me know, but I'll also ask Mallory if she could please identify herself with me. So I'd need her to let me know her first and last name. And then I would just check her ID for her MRN number and just make sure everything matches up first before I continue, just to make sure that she is the Mallory that I will be assisting. Then I'll just check with Mallory that the bedside and everything is in working order for her, so that she feels comfortable and everything's all safe in her surroundings around her bed, that her bed is able to go up and down, that the remote is in working order, all oxygen and air behind her is all working well, all the emergency equipment is in her little bag, and her emergency button is close by. Because she's also had a fall, I'd like her to know that her emergency button is nearby. So I would, in this scenario, because she is an elderly who's had a fall, what I seen in the video was that she was struggling a fair bit. She did look quite worried and not uncomfortable, but she was a little bit disorientated possibly. She might even be a bit uncomfortable, that she doesn't feel independent being in there, that she's had him fall. She might be a bit embarrassed. Yeah, all of these factors could be making her feel a little uneasy being in someone else's care. So what my role would be, just to make her feel comfortable around me and make her feel that I'm there to help assist her, but also help her feel as independent as possible. So I would just ask her if there's anything that she would need help with. As I seen in the video, she was kind of struggling to prop herself up and get the bed rail down. So I could see that was an issue. She did have a plate there. There wasn't any food on it in the meantime. I'm guessing it was on its way. And she did look like she had an injury on her leg, so she wasn't really able to like prop herself up or sit over to be able to eat properly. And she also mentioned that she did want to go to the bathroom at some point. So yeah, I would just make sure that I was there to help assist her. Following on from this, I would check her heart rate and her oxygen, just make sure all of that is in order and that she's all okay, everything's normal. That all seems to be fine, and she seems pretty stable. She doesn't look too distressed by looking at her. Her breathing seems pretty normal just by looking through the video. Also, above everything, it sort of looks like she may be in a bit of pain and she's just struggling to sit up on her own. So following on from this, my evaluation of everything would be, I as a student nurse assisting an RN would ask her if she would mind that I help, as I can see there's possible risks and things that I could help to make her more comfortable. So I would ask if she would mind that I could prop up her bed for her. I would show her where the remote is if she would like to help herself be propped up a little more as well. That would assist with her eating. If she needed assistance with eating, I could do so. There was gloves there. I could help break off the toast and help assist her with that. I could also put the bed rail down on the side just to help pull the table over a little bit more so she could have it in front of her, rather her leaning to the side and straining her back and possibly having another injury. With her needing to go to the bathroom, I could offer my assistance there as well, just to let her know that I'm also there. As there was no walking stick around, which is what she usually needs to help assist her, I could offer the wheelchair that was nearby, and you know, I could ask her if she would like me to help assist her and walk her there, and she could help herself first. If she could help, she can sit herself up. If not, I'm there to help assist. But yeah, I'm always there to offer assistance and to help her feel comfortable. I would just make sure that everything is closer for her in working order to help her feel more independent and comfortable, but always offer my assistance as well. So I would make sure that the remote is close nearby, that she could prop herself up, the bed rail was down, that she could move the table over. I could offer assistance with helping with food, check the oxygen's okay, ask her about her pain, and bring a wheelchair over to help with her mobility a little bit more. And I could also offer my own assistance with guiding her to the bathroom also. And following on with this, just making sure that she feels really comfortable, that she has the emergency button if she needs to with anything else, and that she just feels happy and comfortable in my care. So yeah, that's all that I can see based on that. So hopefully you've enjoyed my video today and my evaluation of the scenario that I had to look at and oversee today. Thank you for your time, and goodbye.